Hi, I'm Dr. David Novanek of Doctor's Choice Physical Medicine and Rehab in Pottsville, Pennsylvania. And today I'd like to talk about workers' compensation and just what is a workers' compensation claim or workers' compensation injury. Well, first off, workers' compensation, the injury, illness, or disease has to happen at work. If it doesn't happen at work, it's not a work-related injury. That's pretty simple. But that gets a little bit more complicated after that. You can have a work-related injury, and that's the most easiest thing to understand. Let's say, for instance, you had an accident at work and you hurt your back. Well, that's a work-related injury. It's very obvious where it happened. Once you get into an illness, that becomes a little bit more difficult. An example of that would be carpal tunnel. Typically, carpal tunnel doesn't happen from an injury. It's an illness. It comes on very slowly. Yet your job could be the main contributory factor to that illness. And the most difficult one to understand is a workers' compensation disease. And the easiest way to understand that would be minor's asthma. So minor's asthma comes on very slow over many years, and it's a disease. But it's still a work-related disease. So diseases are the hardest ones to absolutely say that it came from a work-related disease, or it's work-related. One of the things that you have to know right from the beginning, if you expect that your illness, injury, or disease is work-related, you have to tell your employer. Now, as soon as you understand that it's work-related, that's when you have to tell your employer. And the sooner you do that, the better. It doesn't have to be right when it happens. It doesn't have to be the first day it happens. It doesn't have to be the first week. The law says that there's 120 days that you can give notice to your employer once you understand or believe that your illness, injury, or disease is work-related. So the other thing that people don't really understand as well as they should is they'll come in here and they'll say, I have a back injury, my back's hurting me. I ask them, well, how'd you hurt yourself? And they say, oh, it's always been hurting. Well, that could be true. But what made you make the appointment now if it's always been hurting? And they'll say, well, I was at work and I bent over and I lifted something up and I got pain. But, I've always had a problem. Well, that is a work-related injury. Now, let me try to explain this a little bit better. I have plenty of people that come in here, and let's say they have a chronic back problem, and they'll rate their pain like a 2 out of a 10. And that's as best as it gets for them. They got a chronic problem. But they're working with it, they're living with it, they're not getting treated for it. And then something happens at work, they might have a little fall or a twist or something like that, and now their pain level is up to a 6 or 7. Well, that's still a work-related injury. Now, it's a workers' compensation case up until the point of where you recover to the point you were before you had your injury. In this instance, it would be up to the point, let's say, where the patient goes back to a 2 out of 10 pain. Workers' compensation is not going to pay to get treated until you get to a 0, because you had a pre-existing problem before that. So, if you think you have a workers' compensation case, one of the things is you got to tell your employer. And the other thing is, if you decide to treat with us for a musculoskeletal problem from work, we do keep a list of attorneys for our patients that we've had great success with working with in the past. One more thing, if you'd like a copy of our free report on the workers' compensation law, you can give us a call at 570-622-2525 and ask for the workers' compensation report.